digital health hub model, which was identifying a community partner that was already working with a particular cohort that needed digital inclusion support, in this case older people, in the Crossgates area of Leeds, and looking at how we could bring together the local organisation and local healthcare providers to form a mutually beneficial partnership with a sort of two-way referral process. So was there anything in particular that anybody wanted to know more about on that?
Or any comments you'd like to share?
I leap in with just one general concern. We've talked about digital inclusion, but I'm just wondering how you're working with exclusion, people who are unwilling or unable to use digital, and the tertiary impacts from those. My favourite one at the moment, to quote, is a woman I spoke to, I think mid-70s, like me, severe visual impairment, but unlike me, not at all comfortable with digital equipment, went to her local pharmacy, usual place, to buy some reusable masks, and the response was, oh, we only sell those online. Wrong. The answer is, oh yeah, they're available online, but we'll order some for you and get them returned to you. So it's not just the technology and the training and the technology we have to tackle, it's the culture, and saying, look, there are people for the foreseeable future who are not going to be digitally enabled. We must not disable them in terms of poorer service. And I just wonder how you're working with that and how you're including that in.
So I think absolutely. So as 100% Digital Leeds team and as Leeds City Council, we are not working on a sort of digital by default agenda. What we are trying to do is make sure that people have a range of different ways of doing things, but also informed choice when it comes to choosing how they decide to do something. So obviously we don't have control over different partners and how they choose to deliver, and if they reduce face-to-face services. And especially during the pandemic, we've seen a necessary reduction in face-to-face services. So we're sort of coming at it from both angles. So we as a council are still providing face-to-face services where possible in the terms of community hubs and libraries as one sort of way that we're doing that, but also where there are digital options, we're trying to make sure with the whole scheme that if people choose not to interact with those digital options and choose to go for the face-to-face option, that they're making that choice in an informed way. So it's not that they can't afford the connectivity around getting online. It's not that they don't know how to do it and don't have the confidence to feel that the skills are not something that they can develop, and that it's not that they're choosing not to do it because they don't know that it exists. So we want to remove or overcome all three of those barriers for everyone, and then if people choose to do things in a face-to-face way, that's absolutely fine. And we're also not encouraging any other services, any other sectors to reduce their level of face-to-face service. What we are doing is, in the face of that necessary reduction, supporting them to be able to improve their digital access and change their ways of working to maybe embrace digital, so that they can continue offering those services and reaching those service users. A big part of our digital champions scheme is helping people to understand issues around digital exclusion, but also to help people to be more mindful of those barriers, and also think about when they're signposting people to digital stuff, whether that's appropriate and whether people might need additional support doing that. And also for the third sector organisations like Crossgates and District Good Neighbours that are our first digital health hub, we're supporting those organisations to embed digital into everything that they're doing in a really, really gentle, non-forced way that helps to gently over time help change people's attitudes towards digital and slowly build up a level of confidence. So we would absolutely, with the lady that you're talking about, we would absolutely hope that they were offered an alternative to digital. And if it was a digital champion that we had trained, then they would absolutely be offered that. But we would also be looking for them to have a positive conversation with that lady if the opportunity arose around some of the ways that digital might benefit her, and also to be referred to an organisation that is offering specialist support in that way. So if she has got sensory impairments, it would be to help her to maybe just briefly, and I'm not talking about in a forceful sort of making somebody do anything way, but just helping her to understand that there are organisations in Leeds, like Leeds Bid or Deafblind UK, who are experts in digital and how digital can be assisted to people with sensory impairments, and that it's not something that is impossible for her to be able to develop, and that if she had an interest in developing those skills and using some of that technology, then it might have a holistic improvement to her life, as well as in the future being able to offer her more options when it comes to doing things like buying face masks.
Amy, can I jump in with a slightly different question? It's from a
Yeah.
council as well. We're just over the borders from you in North Yorkshire. In approaching it from a sort of a Leeds council point of view, did you think about, or did you get involved in any organisational shepherding, for want of a better phrase? In other words, if the council wants to go out and promote devices and alternative ways of accessing digital services, 2 days later the local primary care trust wants to do that, 3 days later the local acute trust wants to do that, etc., we'll end up with citizens in their own home with about 4 or 5 different things to connect to different organisations' services. Did you look at how or if you might be able to coordinate that so the citizen themselves might just get one device to use?
Yes, I mean, we haven't seen that kind of activity. So although there's lots and lots of engagement, it's much more, especially when it comes in terms of lending devices or gifting devices and stuff like that, that's probably the most difficult activity to run. So we're not in a situation where people are offered that from multiple places. We are the main part of our role is facilitation and coordination. We don't lead in that we will help organisations in different sectors to understand some of the barriers, but we want everything to be led by those organisations themselves and with their understanding of their service users and the opportunities and all that kind of thing. So we're more in our way of working has been more to make sure that everyone knows who we are, make sure to get as far as possible, especially in terms of council, to get digital inclusion in every strategy and every sort of survey of any work, especially around inequalities and stuff like that, and put our name out there as the first place for organisations and people to go for help and advice. So most do necessarily come through us because of the position that we've put ourselves in. And then a lot of what we do is about linking different organisations and making those connections, as you say, people doing similar work or on the state working with the same cohort of people or whatever. But it's not as direct as trying to make sure that people don't get numerous different contacts, because actually what we sort of lean more on is that there is not any one organisation necessarily. What am I trying to say? So a lot of organisations are all doing things ever so slightly differently in a way that best suits them and all that kind of thing, and we want there to be a whole range of different options so that people can follow the option that they would like. Everyone does it a bit differently. So lots of different organisations doing very similar things and offering it to the same person isn't necessarily a bad thing. It means that there's a range of different options for that person to be able to choose which one they want to engage with, depending on who they've got the best relationship with or what that offer might look like. For example, with older people, a lot of older people would prefer to learn digital skills off another older person because they feel that person has got an understanding of the pace to learn at and also some of their concerns and things like that. Some don't want to learn off anyone. Some want to learn off something like Learn My Way and sit in their house by themselves and go through things. So two organisations offering slightly different things. One might be a course, one might be remote one-to-one learning. We don't want there to just be one approach for older people. We want everyone to be doing something slightly different so that people can pick. I feel like our time is just absolutely...
I know, it's flown by. So
When
we've
did
got
that
about 2
30 seconds left.
Yeah.
Thank you
I
for
just
that.
wonder if there's a role for the ICSs to at least try and set standards, so we've got shared things, so that say one device or could run whatever needed to be done, so that people are just aware of the standards but not being enforced by someone else to deliver the service.
I'll just make a comment just before we get kicked back in 15 seconds. My interest is really about how we can come together as a place, in my case Bradford, and pull together all the activities that are going on in that place for more coordinated approaches, and that's really why I'm here, and that's what I'm most interested in.